So, Mrs. Bona, I would want to kindly ask, what's the FDA's perspective, or what does the FDA say when it comes to restricted medications?
Okay. So with the FDA, we work with a classification system. So pharmaceuticals have been classified into prescription-only medicines, pharmacist-initiated medicines, and then over-the-counter medicines. And under the prescription-only medicines, we have what we call the controlled drugs, which are psychotropics and narcotics. Every drug, irrespective of the class, has to be well labeled. You have to have the active ingredient, your batch number, the full address of the manufacturer, expiry and manufacturing date, and then storage conditions. In addition to that, you should have a packaging set or information leaflet that talks about how it should be used and all of that. When it comes to the controlled drugs, importers have an additional responsibility because these medications can be abused and they can cause a lot of problems. When you take the morphines, the tramadols, the codeines, because of its potential of abuse, there is an additional responsibility on the importer. So when we give you a permit to import controlled medicines, you are responsible for giving us a feedback on how these medicines were distributed. There is actually a convention internationally that gives countries quotas. So if you take something like diazepam, there is a quota for Ghana. So every importer is known. Beginning of the year, a quota is given to you. And you cannot just import, you have to import as per your quota. So if you import a portion, you come back to the FDA to say that this is what I imported. This is how I distributed them. This quantity went to this place. You give us all the distribution records and it must be traceable. And with that compiled, then we can give you maybe another portion that you are asking for. You are responsible for whatever medication you have put on the market. And so our pharmacovigilance team has been very, very active and very proactive on this. We now have institutional contact persons who are supposed to report to us on these things. They give us adverse reaction effects. They give us information on failure of efficacy, safety reports. You are mandated to have such a person to report on all restricted medicines, POMs, prescription-only medicines, the controlled drugs, and then the pharmacist-initiated drugs. For the over-the-counter medicines, most of them don't treat an underlying cause. They support a system. For example, if you have an infection, it is the antibiotic that is going to treat the infection. If you give an analgesic, it's supposed to maybe control the temperature that has been brought about because of the infection. So once a product is restricted, it is dispensed as POM, or as a controlled drug, you have an additional responsibility to give the Food and Drugs Authority some further and better particulars once we've given you permits to import or manufacture and distribute these products.
So, I want to follow up with this. When you say well labeled, just I want to kindly understand what you mean by well labeled, because I mean you can have maybe paracetamol. Someone will come in, register, but it's in English, and then the person doesn't have the importation right, or you've not given the person the right to import, and then another person will bring it that particular medication, though the person is not the one that registered the product with you. So when you say well labeled, and it might probably be in another language. In such cases, do they fall under it being well labeled? And if they don't, what's the FDA's? What does the FDA do in such situations?
We have labeling guidelines published on our website. It's a public document that everybody can access. Every product that is being put on the Ghanaian market, you have the option to have other languages, but English language is obligatory. The information should be in English. You can have other languages, we don't mind, but English should be there. If we say it should be well labeled, the name shouldn't be ambiguous, superstitious, or connote any magical things if it's pharmaceutical, because we deal with science, we don't deal with the supernatural. So if you are giving things that suggest magical and supernatural things, there is no way we can prove it. So we don't allow that. You have to let us have the active ingredients and the excipients. Some people think, oh, once I have paracetamol there, why do you want the talc, lactose, and other things? They are also very important because different people react to different excipients. Some people are very intolerant to lactose, no matter the amount in the product. So we want you to tell us that apart from the active ingredient, it has these other ingredients, so that if someone reacts to something, an excipient, the person will take precaution when taking it. A well-labeled product should have the manufacturing and expiry dates. For pharmaceuticals, it is not like food, water, or drink that you can say it has best before. So before this date, it is best, but after this date, it may not be best, but it is good. We don't allow that in pharmaceuticals because you have given shelf life based on particular studies that you have conducted. So you give us expiry dates. And once the expiry date is up to, the product is deemed expired. We have to have the full manufacturer's address. You cannot just give us some website address and say that it's okay. No, we should know the exact facility that the product is coming from. And back to your earlier statement on importing something on behalf of someone. For you to be able to put a product on the market, it has to first be registered. That is what the law says. Section 117118 of the Public Health Act talks about registration. It has to be registered. If you are importing an already registered product, you should have an authoritative letter from the license holder saying that, yes, this person can also import this product that I have registered. And that is what we call parallel imports. The law gives room for that. But then it should come with authorization of the marketing authorization holder. So you can't just go and bring in anything because you think someone is selling and you've also just gone and brought some. No. And our issues have been with people who travel outside and see things on markets and bring. Things have been made for markets because the world has been zoned based on temperature and humidity conditions. So if you see a product that has been labeled for a particular market, let's say Europe, they have cold temperature for about 7-8 months of the year. When you come to our end here, we are in the very hot and very humid zone. So a product that will stay stable in Europe may not necessarily stay stable in our country here. And it's one of the reasons why you have to go through registration. So you can't just go anywhere and just bring something onto our market.
So before, I know the deputy registrar wants to make an input, but I just want you to kind of clarify this for me. So in such situations where you have those that travel and maybe some even wholesalers even making importing those particular medications, what are the consequences, or what does the FDA do to make sure these behaviors don't go on or is abated?
We have room for what we call personalized prescriptions. So if there is a product which is not on our market and you are importing for particular patients, and we normally have it with the cancer products and some other very rare diseases, we have room for that. So you apply, we give you a permit. You don't necessarily have to go through registration because it's for specialized patients, and it may not even be for commercial gain. You are just doing it for science and for humanity. We have room for that. So if you are doing it for specialized cases, you just apply. It is free of charge. We process, we give you a permit, and you bring. But where you have the intention of putting commercial quantities on shelves, then you have to go through the registration process. And so we had the incidence of UK generics coming into the country. We dialogued with importers. Now we have a guideline on UK generics. We are still in dialogue with the importers. They are supposed to look at our guidelines, have a plan, and see how best they can organize themselves to register these products. So certain situations call for certain actions. It's not a one-size-fits-all. As science progresses, regulation is dynamic. So as we go along and new trends emerge, we also adapt and we fit in and help as and when these issues arise.
Yes, what I want to say on this issue is that the Act states specifically that no person shall supply restricted medicine unless that person is licensed under the Act. And no facility can also supply restricted medicine unless that facility is also licensed under this Act. And there are conditions under which you can supply restricted medicines. And when we say restricted medicines, we are talking about prescription-only medicines, pharmacy medicines, and over-the-counter medicines, and any other medicine that the minister. Yes. So when we say restricted medicine, it doesn't mean it's only pharmacy-only medicine or prescription-only medicines. So before you supply it, we have conditions under which you have to supply medicine and what you have to do. For instance, if you are supplying prescription-only medicines, it should be under a valid prescription, so that you don't just wake up and give out these antibiotics just like that. The Act frowns on that.
So what I want to come back to you. So for instance, fine, you spoke about the generics. So where you have scientific office for companies, the Merck and co, and someone brings it, maybe brings in Bucofic, those already registered. Other importers are bringing it in. But you have someone bringing it through another channel. In such cases, what does the FDA do to make sure such acts do not continue and it comes to an end? Or what are the penalties that FDA metes out to such people when they are?
There are penalties spelled out in the Public Health Act.
Okay.
Yes, so we have penalty units that we can charge you with. There is a term of imprisonment that you can serve. And FDA is very careful when it comes to communication in health, because if you don't take care, people who are doing good business may get their business jeopardized. because they are managing a product portfolio and someone has done something against their product. So you have to manage how you communicate some of these things. So we take punitive actions against companies, except that we are very careful how to communicate it so that we don't jeopardize the business of the one who is doing a great job.
So for Mama Japan, Nana, I'll come back to you.
That's right.
For those products that are coming as such as I described, like how are you guys able to make sure that you don't get these products on your shelf and then they don't get to the patients as well?
I think for every product there is an authorized distributor. And when you are dealing with the authorized distributor, you know you are getting it from the right source. When you take a Novartis product, you know the key distributors of Novartis. So if you want a Novartis product, you go into them and you buy from them. And you also keep good distribution practice, monitor the batch numbers that you are taking and the batch numbers that you are keeping.
I think like Jennifer had mentioned earlier, the institutional contact persons in the facilities is a brilliant idea. I mean, there's no point. If you don't know whether a product is registered or not, all that your ICP has to do is to link up with FDA, and that information is available. And like Anthony had said, we need to start learning that we need to deal with registered entities. As a facility, you have to deal with registered entities. You just don't wait somebody just because you think that you want to make some huge margin profit, go for anything at all. So you're dealing with registered entities. And then just to say something on what the registrar said with respect to if you're doing a POM, a prescription-only medicine. The other thing that we also need to look at is that valid prescriptions don't only come in paper form. You have valid prescriptions in computerized form. And so one of the things I would want, and probably considering the fact that AGM is pharmacy in a digital world, we need to look at what we are considering as a computerized valid prescription. Is it somebody writing something to you on WhatsApp? Do you need to see a signature or something? Should it come through a particular app or platform that we can consider as a valid prescription? Because obviously we are moving away from paper, and so we also need to start looking at the fact that our valid prescriptions could be computerized and not paper-based.
Amazing. You want to throw some light on this for us?
The Act actually talks about electronic prescription.
Okay.
It makes solution to that. After talking about what to do when you supply restricted medicine, it says that those things it has said you should do excludes electronic prescription in electronic form. So then what she said is a lacuna. What form of electronic prescription is a valid prescription? And that needs to be clarified.
So that clarification is not made in the Act. If there's some foul play with regards to medication, substandard medications, or it wasn't transported within the right temperature, I'd want you to just, what's the mandate of the FDA when it comes to storage and then transportation of pharmaceutical products?
So the Public Health Act of 2012, Act 851, mandates the Food and Drugs Authority to regulate pharmaceutical and some allied products. And our mandate is on quality, safety, and efficacy. And so for the product to get to the end user, we have to ensure that it's of the right quality, it's efficacious, and it's safe. And distribution, which includes transportation, plays a very critical role when it comes to the product getting to the end user from the manufacturer. So when you are submitting your application for registration, we require what we call stability data. You give us a data that will that will assure us that throughout the process of manufacturing, storing, and dispensing, the product will maintain its quality. So the long-term data is required to assure us that the shelf life that you have given to the product is okay. The product will be of the right quality and standard at the time that you have given it to stay on the shelf. Then we also require you to do accelerated stability studies. And this takes care of the product during transportation. So it is for a short period under elevated temperature and humidity, so that when you are transporting from one place to another, that the temperatures and humidity may go out of the range, what we call excursions. The product will still maintain its quality within that period, because a product may be manufactured outside, it has to be transported by ship. You cannot really control what happens on the seas. Maybe you have planned that within 6 weeks it has to arrive. There are some waves and other things, and it's taking 3 months for the ship to arrive. We have to take care of that situation, and so we require every product to come with accelerated stability studies to assure us that during these excursions outside the normal stability range, it will still maintain its quality and efficacy, and it will be safe for consumption.
Storage and transportation. As we are talking about, I mean, these are places where medications are kept and then pharmaceutical services are given. But before these medications are moved from one facility to the other, it needs to be stored and it needs to be transported. But I want to kindly ask, I'll still start with the deputy registrar, on what does the Act say when it comes to storage and then transportation in any means possible?
Yeah, if you look at storage of pharmaceutical products, for the wholesaler side, it's the FDA that will license the wholesalers, the big wholesalers. What Pharmacy Council does is that the small ones, like if you have a wholesale retail facility, the small ones, we go in there to make sure that they conform to standards. Yes. Now, Pharmacy Council, we are in the process, and very soon we will roll it out. We have discussed with FDA that all vans carrying medicines will have to be approved. You have to license them. So, from Pharmacy Council side, we will look at the stickers, giving them stickers, so that and the stickers will be tied to the vehicle number and type, so that you don't move the sticker around, so that we can monitor how medicines are moved. And before we do that, FDA will have to approve the vehicle. Have to approve that the vehicle is in a good condition to carry medicines from one point to another, because they will have to look at the temperature of the van, how it is carrying the medicine, before we can ask you to use the van to carry medicine from one point to another. So we are in the process, and we are going to enforce that, because the Act gives us the mandate
So,
to do that.
if I may come into, if I'm a pharmacist, so if I go and buy medications, let's say from Okanshi, and I'm moving the medication to my shop, are we saying my car that I'm going to use to transport the medications to my shop or pharmacy should fall under this?
No.
Okay.
You are just carrying some medicines that you bought to your retail facility. But let me give you a classic example. An importer brings medicines to the port. They are kept under good condition. Then you have a van that takes the medicines from the port to, say, Kumasi. That vehicle will have to be licensed before you can do that. That is what we we are talking about. And we have wholesalers who carry medicines from Accra to Bolga. What they need to do is to just take orders, put them in the van and send them. But we know very well that they carry it and just go about selling. That is van peddling. However, what we want to do is to license them initially. Because if you ask them, they will tell you, yes, we have orders and we are carrying them. And you cannot disprove that. So, for the time being, we are on level grounds. They are carrying medicines to people who have requested for them. But you have to license the farms before you can do that.
And I think this is in the interest of the public, because if you look at how medicines are stored, they have an effect if they are not properly stored. So if the general public will want to go into a pharmacy that has an air condition, then its emphasis is laid on storage. So if the medicine is also going to be exposed to temperatures within certain hours, then the person handling the medicine should know what is the expected temperature within which the medicine should be kept. And like the mandate of Pharmacy Council says, they are there to secure in the public interest the high standards in the practice of pharmacy. So it's in the right direction.
I want to add that on the back to your question, an individual pharmacist goes to the wholesaler, does his purchases, puts in his card. As a pharmacist, you are trained to perform up to a certain standard. You cannot breach that standard. If you breach that standard, you'll be in conflict with ethics. You know, as a pharmacist, how drugs must be stored, how drugs must be carried. So the presumption is that you are doing the proper thing. But for the driver, he is not regulated by any profession, a professional body. So if a driver is to carry medicines in a van on behalf of a retailer or a wholesaler, then the regulator must know who that driver is and whether the vehicle he's using can carry those type of medicines. Because it's common for drivers to go and purchase drugs that are supposed to be stored under certain conditions from wholesalers who have stored under those conditions, and then put the drugs in a compromised condition in the vehicle, send it to the retailer who stores it in the good condition. But the drugs would have been compromised before it got to the wholesaler. But as a pharmacist going to buy medicines, if you go and buy insulin, you, the pharmacist, you put it in a flask because you know that it has to be stored under certain condition. It says under section 98, it talks about restricted medicine record book, where when you supply restricted medicine, you make entries. When you come to 98.3, it says that this section shall not apply to transactions which are recorded electronically. So what is required where it is electronic transaction? It is silent. If the prescription is in electronic form, what constitutes a valid electronic prescription? It is silent. And when the law is silent, anything can happen there. And anybody will go free.
So, if you look at the airline that we are presenting, we have taken care of that.
Okay.
Yes, we have taken care of that. So, it is spelled out clearly. That pothole will be filled.
Would you want to just give a brief
Yes.
light on
I can give you something that is even happening.
Okay.
This Hewale Health something.
Yeah, yeah.
Yes, they've come to us, and theirs is just this electronic thing. And HIFRA is giving them the go-ahead. Ministry of Health is also giving them, Medical and Dental Council, they are orders. So they came to us because they are going to attach some pharmacists who will also be supplying medicines. And that is where we have told them what they are supposed to do. Yes. So at the appropriate time, it will be
communicated.
yes, because the airline has not been passed yet. So we have to.
All right. So thank you very much, all our panelists. It's been great talking to you guys. And it's been, I mean, I've learned a lot from you guys, and I think we'll put the message out there to all those that we learned. I mean, with regards to the inspector walking in at any time, with regards to I mean, at reasonable time, the person, I didn't know about this. I thought maybe when the inspector comes in and after 5, he's done with his work. But from what I learned from from all of you, it states that when at any time the inspector can work in it, I think that message will be put out there for everyone. And thank you very much for coming. We hope to have you guys on set again.